Excellent. And I want to introduce the people on my left and my right. To my right is Professor Barry Scher, who's the provost of Dartmouth. And to my left, Professor Joseph Helbley, who's the dean of our engineering school.
Nice to meet you.
Good morning, gentlemen.
Good morning.
Well, I think we'll
perhaps introduce people from this side?
Sure. Go ahead, please.
please go ahead,
I don't
Kisali.
know whether you see it on the screen, but on my far right, I have Professor Bakari Lembariti, who is the college registrar. He's the custodian of all academic affairs at the college.
Ah.
And next to him, you have Professor David Ngasapa. He teaches anatomy, but he's here as the director of planning and development.
Oh, great.
Great.
Then I think I have Don next to Professor Ngasapa. Have you seen Don?
Yep.
Hi, Don.
It's nice to, it's good to see my colleagues in Hanover and to give you our best with our new colleagues here in Dar es Salaam.
Great.
And I have the dean of the School of Pharmacy sitting next to Don.
Hello again.
How are you?
Good to see you. We have Chicago. We have Chicago weather here.
I can imagine it must be very cold.
I have to my left Mrs. Uiso, who is in charge of leaks at the college.
Hello.
Hi.
Hi.
Oh, I think we shall get to know the others as we go along.
Okay, who's the person? It's the guy.
Ken,
Yep.
should we?
Yeah, I think we
begin?
should get started. Yeah.
Ford may be stuck in the freezing rain.
Right.
It's been a little tricky getting around. Why don't we probably can get started and he'll join us as soon as he arrives.
I think that's a very, very
Yeah.
good idea. Kisali, welcome to you and to all our good friends in Tanzania. Through the marvels of modern technology, we're able now to have the best substitute for being together in one place is to be able to see each other on a screen and be able to do this ceremony, simultaneously. This is really virtual television of the highest order, and I'm delighted. The purpose of our gathering today is a very historic and a very significant event. And for those of you on the Tanzanian side, my name is Kenneth Yalowitz. I'm the director of the Dickey Center for International Understanding at Dartmouth College. And I've already introduced our provost, Barry Scher, the dean of the engineering school, Joseph Helbley. But also let me introduce, to those of you in the audience in Tanzania who may not have met him before, Dr. Steven Spielberg, the dean of the medical school here at Dartmouth. And what we're going to be doing today, as I said, is a very historic and I think a very important development. It's going to be the signature of a protocol, a memorandum of understanding between the Muhimbili University College of Health Sciences in Dar es Salaam, Tanzania, and Dartmouth College here in Hanover, New Hampshire. And the signatories will include Dr. Kisali Pallangyo, who is the principal of the Muhimbili University, and Steven Spielberg and myself. And the significance of this protocol is that we are going to be signing an agreement which builds on progress. It builds on projects that are already ongoing between the Dartmouth Medical School and the Muhimbili University, but it builds in a way that will be multidisciplinary, that will involve students, faculty, disciplines, groups from both institutions, and hopefully more broadly, because this protocol is directed on cooperation in global health. And global health very, very much involves not just the medical profession, but a variety of specialists and professions. The problems are complex, they're interrelated, and they really require a multidisciplinary approach. And the cooperation between Dartmouth and MUCHES, the Muhimbili University College of Health Sciences, really underscores that this is meant to be a broad, a very wide-ranging type of cooperation. And we very much hope that the signature of this memorandum will open up many opportunities for genuine partnership. It is very much a partnership arrangement, and for cooperation and learning between students and faculty on both sides. We're also, as I said, I'm very, very delighted, just on a personal note, that the Dickey Center for International Understanding here at Dartmouth is playing a role, in this, along with the medical school, the engineering school, the business school, and Dartmouth College. So this is very much a Dartmouth-wide endeavor. And I'd like now, if I could, I wanted very much to express my own personal appreciation to you, Kisali, Dr. Pallangyo, and all of the faculty members from the Muhimbili University who are in attendance, and all the wonderful people that Steve and I met this past summer when we were in Tanzania. We feel very, very fortunate to have you as our counterpart, and we feel that we have a very, very strong base on which to build this multidisciplinary cooperation. So with that, Kisali, I'd like to turn the floor over to you, sir, and it's very, very good to see you.
Thank you very much, Ken. I think you have said it all. This is, to me, an historical and important milestone in our relationship between the two institutions, as well as between individuals. And I sincerely hope we will be able to put up a framework through which our staff and the students can establish linkages and work in areas of mutual interest that they so find fit. I can only think back, and I can see Ford is now coming in.
Yes.
I was telling the group that, is this thing working?
Yes, perfectly.
I think it's gone off. I was telling everyone here that Ford and I literally met on the internet about 5-6 years ago, and our meeting has grown into what it is today, and I really hope and pray that the interactions, the collaboration, the working relationships go far beyond a few individuals to involve our whole institutions both in the US and in Tanzania. So it is indeed very exciting and thrilling to me that we are today witnessing a process of expanding and upgrading the areas for potential collaboration and working relationship between our two institutions. As you know, Ken, you were speaking from your past life of working in the diplomatic missions, and you're used to these kind of things. I'm new to these kind of things, and this is indeed a very exciting experience for me.
Thank you very, very much, Kisali. I must say from my former life, these things are exciting. And they're exciting because they bring people together to do things, that for a common purpose. And that's why, as a diplomat, I never got tired of events like this. And this one is particularly meaningful to me. I'd now like to ask the provost of Dartmouth College, Barry Scher, to speak. Barry?
Okay, thanks, Ken. Again, I would simply like to say today how pleased Dartmouth is to be signing this Memorandum of Understanding with Muhimbili University College of Health Sciences. We really see this as a key step in the Global Health Initiative, which is being led by Dickey Center and by Dartmouth Medical School, but also which involves a collaboration of parts of the entire institution. Tuck School, Thayer School of Engineering are playing key roles, as will be the Faculty of Arts and Sciences. We really see this as a kind of interdisciplinary effort, which really emanates from Dartmouth's strengths as an institution, and we're delighted to see them focus so clearly on the issues of global health. To cite just a few examples of how we see this working going forward, I would note the involvement of our Tuck School of Business, which is already studying the feasibility of establishing a pharmaceutical industry in Tanzania. And we're already having some talks about the possibility of creating a Kiswahili course here at Dartmouth, which would not only satisfy a general interest among our students, but also enable those with specific interest to gain valuable language training before participating in this program. And I would note as well that we see other possibilities for academic collaboration between Dartmouth and the University of Dar es Salaam, among others, that may grow out of this agreement. Now, this Memorandum of Understanding is really built on some concrete accomplishments to date. And for those, I really want to thank in particular Dr. Ford van Rijn of the medical school, who has collaborated with Dr. Kisali Pallangyo in the ongoing Dar, that is Dartmouth and Dar es Salaam project, which includes the development of a vaccine for tuberculosis, setting up a pediatric AIDS clinic, and the training of Tanzanian medical and scientific personnel at Dartmouth. Thanks to these efforts, our collaboration is already off to a strong start, and we now have a firm foundation on which to build going forward. Certainly, it is thanks to Ford's substantial work in these projects that we have come to see Muhimbili University College of Health Sciences as a natural partner as Dartmouth proceeds with its global health initiative. And as others at Dartmouth have gotten to know that institution, we've become impressed by the work that is being done there, as it helps the country battle with some very real and very serious health issues, including malaria as well as AIDS and tuberculosis. The human losses to these diseases have been high, and there's much work to be done in order to address these illnesses as effectively as possible. In concluding my very brief comments, I would like to emphasize again some key points. First, that Dartmouth as an institution is pleased to see this effort get underway. We see our participation in this as contributing to a genuine need, not just for the U.S. and Tanzania, but for the world at large. Second, this initiative is based upon a Dartmouth-wide effort, with all parts of the institution participating, and with the involvement of not just faculty, but of Dartmouth undergraduates and graduate students. And finally, we're looking forward to a genuine partnership with our Tanzanian counterparts and to learning from each other. The Memorandum of Understanding that is being signed today offers us a fine framework within which to establish that partnership and to create further collaborations in the years ahead.
Thank you very, very much, Provost Scher. Kisali, before I introduce Steve, may I just ask if there are any other people from your faculty that you would like to say a few words right now? Kisali.
I think, I'll ask the registrar to say a word or two. I'll also ask one of the medical students, if they so wish, to say a word or two, because I truly believe that this collaboration should go into a generation well after we are gone. So I'll want one of the medical students to say something if they so wish.
Excellent. Then please, if the registrar could speak. Yeah.
Hi guys. Good morning. At the outset, let me register our appreciation for the forthcoming of the Dartmouth group to join us in this very, very important memorandum of understanding. We at MOOCs believe that the signing today of this Memorandum of Understanding will create a framework that will define how our two institutions initially are going to work, but also encompassing the University of Dar es Salaam later on. We believe that we will establish a long-lasting relationship between our staff and students, and also believe that through such relationship, our staff, our students, your staff and students will work together in pursuit of academic excellence. On our part, we pledge and promise to honor the Memorandum of Understanding and will strive to accomplish the intended objectives. Long live the MOOCs Dartmouth Corporation.
Here, here.
Excellent, thank you very much. And now may I introduce Dr. Steven Spielberg, the Dean of the Dartmouth Medical School.
Kisali, it's wonderful being back with all of you today. I wish we were there in person. I think Ken and I and our experiences in DAR were among the most remarkable that any of us have had in our lives. And I think have really solidified the commitment of all of us here at Dartmouth to the issues of global citizenship. It's pretty clear, I think, to all of us that the issues we face are enormous. The health challenges that we face here and throughout the world are going to be integral to our ability to achieve international understanding, to enhance peace, to enhance economic development, to enhance the quality of life of all our citizens internationally. And it's been a particular joy working with our colleagues at Muhimbili to advance our mutual understanding of our responsibilities, of our opportunities together. And this particular Memorandum of Understanding really drives towards our understanding that international health is no longer just the province of medicine. It's the province of multiple disciplines working together. Having colleagues from engineering, from business, from arts and sciences, all striving to address some very difficult problems that we face right now. And I'm convinced, as I think you are, Kisali, that indeed it is the next generation that's going to help solve these things. One of our greatest joys was thinking about how to increase communication between our students. In their hands really lies many of the solutions to the problems that already exist. It is their enthusiasm, it's their, if you will, naivete to not saying, oh, it can't be done. It can be done. And I think having our students increasingly interact over the next numbers of years is going to be a vital component to solving problems that seem insurmountable to us today. We're working to increase our ability of our students to communicate. Our current setup is pretty remarkable that we can talk to you in real time. I hope that we'll have facilities that will allow our students to have lunch together, to talk together about their challenges, about their understanding of potential solutions, of becoming real partners, real friends, and bring understanding of medicine to engineers, to business students, to arts and science students, to ethics students, to allow them, in fact, to share their frustrations, their ideas, their view of the future together in real time. And that's going to be all part of this Memorandum of Understanding as we're going forward. Our ability to communicate today, we have to turn around to look at the screen here. We're going to be doing this a lot better over time in ways that really will allow us to all address issues together. So when I think about medicine, we talk about triple threat of education, research, and patient care. And we're going to be doing all of those things together. But I'd like to think of our relationship now between our two schools as really quadruple threat, going way beyond medicine into areas that are complementary and sometimes really challenging to bring together. And I think working together, we have a chance of really demonstrating to the rest of the world how two schools very far apart can partner broadly on areas of mutual interest, learn from each other, teach each other, and actually change our current system, which doesn't serve any of us very well, into a system that really does serve all of us very well, and all of our patients and all of the world very well. So it is a true joy for all of us here at Dartmouth Medical School and at Dartmouth College to be partners with MUCS and with the University of Dar es Salaam. This is just the beginning, and I view this signing sort of as a culmination to everything that Ford and his group have been working on up to now, but really looking to the future, what all of us here at Dartmouth and what all of us at MUCS and the University of Dar es Salaam can accomplish together over the next numbers of years.
Thank you very, very much, Steve. Excellent. Kisali, as a good example of the interest here, broad-based at Dartmouth in pursuing cooperation, Steve and I met this morning with Joe Helbley. Joe is the dean of the engineering school, as I mentioned to you, about possible projects in the future. And Joe asked, and I'm just passing on the request, that the dean of your engineering school, if we could put the two of them in direct contact, I think that would be very, very helpful. But Kisali, if you would introduce next one of your medical students, that would be wonderful.
Thank you very much, Ken. I'll introduce Fabian Mombeck, who is a third year medical student, just starting his clinicals. But he's also, I think, the Secretary General of the student organization at the college. Good. Fabian?
Ambassador Yalowitz and Professor Spielberg, we are so delighted being part of this signing of the Memorandum of Understanding. We believe you started a good thing which for us as students is going to help us to achieve so many. And where we were told that we should be participants of this huge event, we thought we should send a message to Brett, who we have been consulting for such a number of days, that students from Muhimbili University College of Health Sciences are ready to undertake initiatives to cooperate with you. And we have also analyzed some areas on which we think you can cooperate with students from your college. To start with, this should be a message that I would ask you to take to Brett, who is the president of the Medical Association in your college, that students from Muhimbili University College of Health Sciences are ready to cooperate and start a journal, because we have checked over the internet and we found that your students are also doing their own researches. So we believe we can learn from you and they can also learn from us. We also believe that if we have an elective exchange or student exchange, students from our part and students from your part can have a kind of knowledge when they learn from different environments, because we believe we have a rich environment on which they can learn from tropical diseases which might not be present at your level. But also, Ambassador Yalowitz, I would like you to know that students at my college, our college rather, they have started their own book project so that they can subsidize the low amount of materials they have. And we believe your students can also learn from us that not only to wait for a college or to wait for the government to take initiatives, they can also do things better without taking any help from anywhere. Ambassador Yalowitz, I believe for this big thing like signing of the Memorandum of Understanding, we can also students learn from each other. And my students have said they are ready to have an online discussion time after time with their students. I would like to ask the Dean of Students from the medical school that if you can set up a good and a well-managed timetable, then students from my college and students from your medical school can have a time to exchange ideas because we believe if you can exchange clinical findings and things of the sort, then you can learn from each other. But finally, I would also say that it's a good time for us as students to be partakers of this memorandum of understanding, because we are starting a kind of a personal friendship with students from your college. So please take our message that students from Muhimbili University College of Health Sciences are ready to learn from you, and they're ready to cooperate with students from your college. Thank you very much for this memorandum of understanding.
Fabian, thank you very, very much. My one comment is I think the Tanzanian diplomatic service could very easily use your services as well as a doctor. That was very beautifully expressed, and I think all of us feel we're all working for the next generation, and you expressed exactly what we're trying to do beautifully. Stephen.
We literally couldn't be more thrilled with that, and I will indeed convey those messages to Brett and our students. We've been having a whole series of meetings about how we can best partner. I'm much more confident now after your statements than I ever have been. We're going to make this happen, and the reality of it is you're going to make this happen. This is great. Thanks so much.
Absolutely wonderful. And finally, I'd like to introduce Dr. Ford van Rijn, who's really, I don't think we'd be doing this today if it weren't for what you started, Ford.
Thank you, Ken. Well, Kisali and colleagues in Tanzania, I just want to say how pleased we all are here. Hello. Richard Waddell, myself, Lisa Adams, and many others who've worked with you over the years. We really consider it a great stroke of good luck that we had the fortune to meet you and to begin this collaboration, to find that we had common interests, to find that you were such wonderful collaborators, and to find that from the beginning we always felt that this was a two-way exchange. We were learning from you. We were hopefully providing things that were useful there, and we're just so excited about seeing this go forward in every conceivable way. From our perspective, we really hope that the research we're embarking on together will make differences in outcomes for people with HIV and tuberculosis in Tanzania, and we will hope to continue that work and expand it to other areas using the resources we have here, and then welcoming with gratitude the resources you're going to be sending this way. I can't wait to learn Kiswahili in the snowy winters of New Hampshire here. So thank you again.
Thank you very, very much, Ford. I think now, Kisali, we can proceed. Are there anyone else from Tanzania, from Dar, who wishes to speak before we sign the memorandum, Kisali?
Yes, there's one other medical student, a president of the Medical Student Association wants to say a word or two.
Great, please.
Mr. Thomas?
Hello, Ambassador Yalowitz and all other delegates from Dartmouth University. My name is Thomas Athmani. I'm the third year medical student and the president of Tanzania Medical Students Association. And actually, I was the one who was chatting with Brett on the internet about expanding the collaboration from the top officials level to students level. And I'm quite excited today that we are having such a milestone towards our collaboration at the college level. And I'm also excited about the projects which are now undertaken, like a clinic for children with HIV/AIDS, a trial of vaccine for TB associated with HIV/AIDS, and that 5-year FOGAT training grant for AIDS researchers in Tanzania. I think it's really great, and I'm so grateful that today we are going to witness this very memorable event. And thank you, Ambassador. Send our message, as Mr. Fabian said, to Brett, that we are really excited and we are looking forward to have a collaboration and cooperation and discussions online with med students from Dartmouth. Thank you very much.
Thank you very much as well. I think you can count on a good deal of contact and interconnection with our medical students, with our engineering students, our business students, and also we have a new group on campus, an undergraduate group called the Dartmouth Coalition for Global Health, a very active, a very vital organization, and I think you can count on very close contacts with all of those groups in the future. I think now we can proceed to signing the protocol. Kisali, we have a number of copies, and I assume you do as well. And what I would propose is Stephen and I will sign several of them, and you do the same. And then we'll also use the magic of Federal Express or one of the other services to send them back and forth. Does that sound all right with you?
Fine with me, Ken.
Okay, well, we can go ahead and sign here. We're going to sign several copies.
How many copies should we sign?
I have 4, Kisali.
All right. I can have 4 copies as well.
Good. Now, if this were a diplomatic event, Kisali, we would be, rolling out the champagne right now. But at any rate, we'll do it symbolically.
Well, I think I've finished signing the 4 copies.
Excellent. We have as well. And I'm delighted because I think all of us can regard this document as signed and official. Congratulations, Kisali.
Congratulations to all of you.
I would just ask now if there are any members of the audience, either here or in DAR, with you, who wish to ask any questions or make any comments. Let's start here. Anyone here have a question or a comment?
Anybody else?
Nope. How about on your side?
Anybody else? 2? Okay, we have 2 who wants to make a question or a comment.
Please.
No, Don, you start. Don, you start.
Yeah.
Sounds like a dentist.
This is Don Conway, and I just wanted to personally thank Kisali and the Dean of the Pharmacy School for the warm and the gracious reception that we've received today and here in DAR. Certainly the Memorandum of Understanding is a multifaceted document, and it's really in the spirit of a true partnership in forming an enduring relationship. There are many students on this side of the partnership that are interested in visiting and contributing in Hanover, even with the 5 inches of rain and 5 inches of snow and rain. Our team from Dartmouth here is really here in DAR because of the support of many individuals in Hanover and the time that you carved out of your very busy schedules to spend with us. Certainly, I have to thank Paul Danos, Dr. Ford von Ryan, his work, his tireless work, is really the raison d'etre for this entire collaboration. For Ken Yalowitz, Ken, this is an entirely a Dartmouth community project with Sarah Schuster, who's here from the CECS school, 5 Tuck students, and a student from Dartmouth from the Thayer School, Doug Midori. We have a lot of sponsors, but none of them more serious and more committed than Steve Spielberg. Both as a pediatrician and a clinical pharmacologist, his professional experience at the hospital for sick children and also in industry has been an inspiration to us, and we know that he really knows his stuff. So we have a very high standard to meet. And finally, I want to thank Dr. Barry Scher for his articulate comments, and after reading the Memorandum of Understanding, I think you would even approve of the cadence of this document. And thank you again for the support from Hanover.
Thank you, Don.
I think the next one is one of the medical students.
Yeah. Thank you, Ambassador, Dr. Ford, amongst others. We are very happy, and we do say that this memorandum that have just been signed to live longer than even the generations to come. My major concern, I just asked the Dean School of Medicine to at least give us on some hints on whether your medical students are participating in some of the development projects in communities there, and at least see in a way so that we can be able to form such kind of development activities in our places also. Another issue is on about the community medicine, whether in your place there are chances of having such studies on community medicine and how they are pertained. Thank you.
Good, Stephen.
I think the questions are wonderful ones, and really things that we seriously want to address together over the next while. Our students here are involved in a number of areas that really go beyond medicine in terms of community involvement. Dartmouth Medical School is one of perhaps the top 3 schools in the country where students go well beyond the standard curriculum into the community. Nearly 100% of our medical students do some sort of volunteer work within the community. Everything from direct service in HIV clinics. They've set up a number of free clinics around both in New Hampshire as well as in Vermont, are the 2 states that adjoin the medical school, and are involved internationally in a number of areas. One of our hopes from this is that we will have increasing number of student exchanges between Dar es Salaam and Dartmouth. Opportunities for students to do electives in Dar and explore issues that we don't see here, such as tropical medicine, a number of other aspects of healthcare delivery that are very different in Tanzania than they are here. But again, by learning and contrasting and comparing our systems, I think we probably can help each other a great deal. And in terms of community medicine here, I think we'd love to explore some opportunities where students from Dar might come here and have similar exchange experiences. All of these things are open, and as I said to our students when we first started this initiative, they asked, what do I want from this? I said, that's not really the issue. It's what our students want, what they see in their mind's eye as a way of making the world just a little bit better. The kinds of experiences, the kinds of exposures that will help them to understand what global citizenship and global healthcare are about, and the kinds of partnerships that can exist. You know, despite the fact that we're thousands of miles apart, we're talking directly right now. It's going to be happening more and more, and we want more visits up and back. So my charge to our medical students here was to be creative, a little bit outrageous, think out of the box, think about those kinds of things that will drive their educations, your educations, in a way that perhaps we didn't have the chance to explore when we were students. So all things are on the table, all things are open, and I think many of the initiatives are indeed going to come from students at MUCS, students at DMS, and thinking creatively how to drive curriculum and to challenge us as faculty and as administrators to come up with interesting and novel and innovative approaches to increasing learning on all sides.
I just want to add a word to Stephen's answer to that excellent question. We are planning now, hopefully, to introduce a course on global health issues into the undergraduate curriculum, into the Dartmouth College curriculum. We hope very much that we'll have an instructor in Kiswahili coming from Tanzania to Dartmouth to teach in the not distant future. But I also just wanted to mention that our center, the Dickey Center, and other centers on campus provide opportunities for students, to do internships and research overseas. And I'm very much hope that our students will avail themselves of that opportunity or those opportunities to come to Tanzania to do research in projects perhaps related to what Fort Von Rijn is doing or other projects that will develop under this protocol. And I certainly hope, as Steve mentioned, that in the future that we will be able to welcome students from Tanzania here as well. Are there any other questions or comments? None here. How about on your side, Kisali?
Yes, there is one more medical student who wants to talk.
Welcome, please.
Thank you very much. I'm really so excited with the signing of this memorandum, being a young generation moving forward. Actually, I would just want to make a comment that being now having a dramatic change in technology, we are supposed really to accept a couple of challenges that are happening in our setup and to make them or to translate them into the new input of knowledge that we are having. And it is my understanding that with the best and the possible understanding together between Dartmouth and the Dar es Salaam MUCS students, I believe that we are going to tackle a number of issues with the entire spectrum of education, taking care of the patients that we are looking forward to serve the community, and a number of issues so that we can come out as good and wonderful physicians, scientists, and the lecturers and teachers of tomorrow, as our lecturers are giving us education. So to say, I believe this one is going to be a wonderful thing to us as a new generation. And personally, I make up my commitment to see to it happening and touching a number of generations to come so long as I live. Thank you.
Thank
you very much again. The students are wonderful, Kisali, just wonderful. Well, I think that probably will bring us to the conclusion. This has been a wonderful, wonderful event. It's a gray, cloudy day here in Hanover, but I feel a lot of bright sunshine in the room right now. And I congratulate you, and we very, very much look forward as we work together to implement this protocol and to really build this wonderful partnership and build onto it in so many creative ways as we've been discussing today. Good luck to all of you, and we really look forward to working together with you.
Thank you very much, Ken, and we wish you good luck and a good day, since your day is just beginning there. It is now 10 to 7 in the evening here, and so we are looking forward to going home now.
Thank you very much, and enjoy your dinners. Thank you. Bye-bye.
Bye-bye.